everyone, I welcome you all my dear students and my viewers. Today topic of discussion is renal calculi or the kidney stones. Kidney stones are crystals deposits of varying size that form in the kidney and could be formed in the ureter also. Nephrolithiasis refers to renal stone disease. Urolithiasis refers to the presence of stones in the urinary system. Stones or calculi are formed in the urinary tract from the kidney to bladder by the crystallization of substances excreted in the urine. So, the stasis or obstruction of these minerals can lead to the formation of stones. Kidney stones are small, hard deposits of minerals and acid salts on the inner surface of the kidney. Alternative names include renal lithiasis, renal calculi, and nephrolithiasis. Stones are classified by their location in the urinary system and their composition of the crystals. Now, the causes. Highly concentrated urine or urine stasis could lead to the formation of stone. Then imbalance of pH in urine. Acidic urine can lead to the formation of crystalline stones and alkaline urine can lead to the formation of calcium stones. Then gout. Gout is a condition where the uric acid gets increased and lead to the formation of uric acid stones. Metabolic causes is like hyperparathyroidism increases serum calcium level resulting in hypercalcinosis and result in calcium oxalate stones. Then certain drugs, medications and repeated recurrent infections can also cause stone formation. The risk factors are immobility. So the immobilization will cause the formation of calcium oxalate stones. Then weather, hot climate can result in formation of stones also because of the precipitation of calcium. Then dietary factors like patients who are consuming more meat, fish, eggs, tomatoes and milk will result in production of calcium oxalate stones. Obese people with immobilization and with unhealthy lifestyle are at high risk. Now the presenting features of renal stone. There is abdominal pain accompanied with nausea, vomiting, fatigue, elevated temperature, BP and respiration. There is steady pain, left flank tenderness, presence of urinary tract infection, fevers, chills, pain in groin, labia and back pain, frequent painful urination, blood in urine, fever, unhealthy urination. Could be dysuria and foul smelling urine or cloudy urine because of the infection. Now the pathophysiology. First, the stasis and obstruction will lead to the urine saturation. There will be increased elevated solutes and then the supersaturation of the solutes will occur. Crystal nucleation will occur and then the aggregation, that is the crystals will combine and fuse together to form the stones. Now the types of stones. There are varieties of stones that include calcium phosphate, calcium oxalate, uric acid stones, cystine and struvite stones. Let's first understand the calcium oxalate stone, that is the common type of stone called as mulberry calculi. It is irregular having sharp projections and oxalate stones is hard and single and they produce hematuria very early resulting in deposition of blood over the stone giving a dark color to the stone. It occurs in infected urine and contains alternate layer of calcium and bacterial vegetation. Then the phosphate stone. Phosphate stones are smooth, round and consist of triple phosphate of calcium, magnesium and ammonia. They are dirty white to yellow in color and commonly occur in renal pelvis and tend to grow in alkaline urine and form staghorn calculus. This calculus produces recurrent urinary tract infection and hematuria and slowly damages the renal parenchyma. Third variety is uric acid stone. This is common in patients who consume red meat. They are multiple, small, hexagonal, faceted, yellow colored and contain calcium oxalate which makes them opaque and are radiolucent and occur in acidic urine. Fourth variety is cystine calculus or could be called as cystine stones. Cystinuria is an inborn error of metabolism which occurs due to decreased reabsorption of cystine from the renal tubules. This cystine stones occurs in young girls at puberty. Increased excretion of cystine in urine results in cystine calculus. These cystine stones are hard, radio-opaque due to sulfur content. There are other varieties also like struvite, xanthine calculi that are rare, brick red and smooth, rounded. Indigo stones are fine and blue colored due to presence of chemical indicator. Investigations of renal calculi include blood urea and creatinine to rule out renal failure. Then plain X-ray is done where enlarged renal shadows can be made out. Urine culture is done. Ultrasonography is done to diagnose the stone in size and to find out the exact location of stone. Cystoscopy is done, intravenous pyelogram to locate the stone exactly in relation to kidney and ureter and to assess renal function, where the dye is injected and X-ray is taken. Beside this, CT scan is also very good investigation, and urine is sent for culture and sensitivity. Treatment of renal calculi focus on two objectives. First, to relieve pain and other accompanied symptoms present, and to identify the cause and prevent kidney stone from reoccurring. So patient is reassured, educated and convinced to be hydrated, because small stones less than 5 mm in size pass off with intake of copious amount of fluid and at time of forced diuresis. And also patient is advised to take low sodium diet and to maintain healthy lifestyle along with exercises. Proper medications along with lemonade intake is must. Now the surgical procedures depend upon the location of the stone and the size of stone. So lithotripsy is the procedure where the extracorporeal shock waves are given by the lithotripsy machine. This shock waves will break up the stones, and then the stones will easily pass from the ureter into the urine, so that will get excreted in the urine. Besides shock waves, stones can be break down by laser technique also. Other surgical procedures include pyelolithotomy when the stone is in pelvis, nephrolithotomy when there is intrarenal pelvis, the stone has to be taken out through the kidney parenchyma. Then pyelonephrolithotomy when the stone is extracted through an incision in the pelvis as well as renal parenchyma. Nephrectomy is the procedure when the kidney is destroyed by pyelonephrosis following obstruction by stone.